Hey guys, welcome back to my channel. If you're new here, my name is Rosie, and if you clicked on this video, you're probably wondering how I became a double licensed RN, so stay tuned. So this is the first video, my intro video to my nursing playlist and my NCLEX playlist. So if you are an aspiring nurse, an RN from overseas, and you're hoping to one day work in the US as an RN, I highly recommend that you subscribe to my channel, because in my NCLEX playlist, which is the exam that every RN LPN has to take to become licensed here in the US, I'm going to talk about my advice, how I studied the NCLEX, the tools I used, how I studied pharmacology. I'm going to dive into my pharmacology binder, which is pretty thick, and a lot more stuff. I have around 7 videos upcoming based purely on the NCLEX, so highly recommend you subscribe if you're due to take the NCLEX or hoping to take it in the future. So in this video, I'm going to talk to you guys about how I became a double licensed RN. By double licensed, I mean I can practice in 2 different countries. I have 2 RN licenses. I can practice in England and the US. So I'm going to talk to you about my journey in nursing, how I got my 2 licenses, and the whole process that I took. So before I started this series, I wanted to talk a little bit about my background in nursing and how I got my first RN license, which is from the UK. If you can't tell by my accent, I am British. I was born and raised in England, and I knew that I wanted to be a nurse when I was 12 years old. So that was my goal from then on. I got my Bachelor's of Science in Nursing in 2016 is when I qualified. I was focused on the adult field. So in England, if you don't know how we train over there, we can either choose to do adult nursing, psychiatric mental health nursing, midwifery, which is a separate degree, or we can do pediatric child nursing. So I was focused on the adult side of nursing. We do touch up slightly on each of the other areas, but it's like very, very minimal experience and exposure to those fields. As soon as I finished my bachelor's degree, I already had a job lined up on the graduate program at my local hospital, and I started work there straight on the intensive care unit I worked there for around 11 months before I transferred to the NICU, which is a little bit confusing because the NICU is a pediatric unit, but weirdly in England you don't need to be pediatric trained to be able to go and work on the NICU. They do allow adult trained nurses to go and work there, which I did find really weird in the beginning, but I ended up only working there for around 4 or 5 months until I decided to go PRN per diem on a med-surg hospital, purely so I could create my own schedule. I met my husband at that point, so we were traveling back and forth, just so much easier to be able to work 60 hours 1 week, but then have 5 days off, or literally be able to create my own schedule. So that is the reason why I ended up leaving the NICU so soon. In total, I have 18 months experience of working in the UK as a nurse until I moved to the US in May 2017. I didn't actually start my nursing journey here in the US until April 12, 2019. So I was here for nearly 2 years before I started my journey, which I started quite late for a couple of reasons. We got married, we had baby, I had to complete all of my immigration, which took 18 months. So I didn't actually pay and send off for my nursing license until April 12th, and then I passed my NCLEX on February 1st of this year. So it took me around 10 months in total from the day that I paid and sent off until I actually passed the exam. So know that one of the reasons why my application took 10 months and not a shorter period of time was because my school, my university back in England, took forever to get my transcripts together and send them off. As soon as I paid, they promised that they would have them sent off within 8 weeks, and I believe it took them around 15, 16 weeks. So double the time that they had promised. It was really unorganized, had to get the head of nursing involved, and it was just a complete mess. But once they were sent off, it was good to go with my agency that I used, which I highly recommend if you are going through the process and you need to use an agency for your transcripts. I highly recommend Joseph Silney. They are based in Miami and do transcripts for other states in the US as well. So I highly recommend Joseph Silney if you need to use a transcript agency. They promise that as soon as they have all of your paperwork from your school and everything they need, that they will only take 2 weeks to process everything. And they fulfilled that for me, so I highly recommend them. During my process of applying for my RN license out here, I had to attend a meeting with the Florida Board of Nursing to discuss my application. I was slightly deficient on hours in OB, pediatrics and psychiatric because, as I mentioned, I'm adult trained, so I didn't do a lot of experience in the other 3 areas, and they wanted to discuss that with me. It was super scary, the meeting. It was literally like going to court, but they discussed my case with me. They asked me several questions and they ended up approving my case right there and then, which was December 5th. The following day I received my ATT, which is my authorization test, meaning that I could go on and actually book my test with Pearson VUE. So I booked it the following day, the day I received my ATT. I booked it for February 1st. So I gave myself around 7 weeks to study for the NCLEX, and I passed first try. Woohoo! The NCLEX is super hard exam in my opinion, especially if you're internationally trained, because there's so much that you reteach yourself. Nursing is out here. For me, I had to learn a lot about pediatrics, psychiatric and OB because I didn't learn too much of that in my degree. Not only that is there's a lot of new medications, new medication names. There's a lot of new nursing roles that we didn't do in England, which is done out here. So I had to teach myself a lot of stuff, which, you know, in 7 weeks to go through all of that was really hard. But I created a schedule, which I'm also going to do a video on how I got organised for the NCLEX, and I used several study material. I had a particular way of studying which I really think was one of my keys why I passed the NCLEX first try. I want to share with you guys how I studied for the NCLEX and resources and how I studied pharmacology. I'm going to share with you guys my whole pharmacology binder, which hopefully will help because in my opinion pharmacology is such a hard subject to study, so hopefully this will help. So I'm going to be sharing all of this in an NCLEX series. So if you're due to take the NCLEX, or like I said, if you are an aspiring RN here in the US or international, you want to work here in the US, I highly recommend you subscribe so you can catch those upcoming videos, which I really think will help you if you're due to take the NCLEX. Thank you so much for watching this video. I just wanted to do a little intro into my nursing journey, why I went into nursing, how I got my UK license, how I got my US license. So I hope this was a little bit informative, but ultimately I just wanted to do a little intro into my journey. Also, I just wanted to add, please let me know in the comments down below if there's anything in particular that you want to see on my channel that you want me to talk about, or if there's a particular video you would be interested in me doing, because as a small channel I will definitely see and read your comments so I can get that done for you guys. So please let me know down in the comments. Thank you again so much for watching. See you soon.